The health information contained herein is provided for educational purposes only and not intended to replace discussions with a healthcare provider. All decisions regarding patient care must be made with a healthcare provider considering the unique characteristics of the patient. And now we're on to our next destination, Lung Cancer 101. It's important to know that not all lung cancers are the same. A diagnosis can differ from person to person. There are two major types of lung cancer: non-small cell lung cancer, which you may hear referred to as NSCLC, and small cell lung cancer, which you may hear referred to as SCLC. While lung cancer may be caused by factors such as smoking, exposure to radon, and air pollution, we don't know what causes every case of lung cancer. It's important to know that anyone who has lungs can get lung cancer. Non-small cell lung cancer and small cell lung cancer are different. While non-small cell can grow anywhere in the lungs, small cell tends to start in the airways in the center of the chest. After the type of lung cancer has been identified, doctors will determine if the cancer is spread, and if so, how far. This process is called staging, and it's one of the most critical steps to establishing a possible prognosis and treatment options. There are 4 main stages of non-small cell lung cancer: Stage 1 to Stage 4, with substages within each. The stages are represented by a combination of numbers and letters and may be expressed by Roman numerals. These classify the tumor based on its size, location, and if it has spread to the lymph nodes or other organs. The higher the number, the more the cancer has grown and/or spread. When treating non-small cell lung cancer, biomarker testing can provide a more complete diagnosis. These important test results can help guide you and your healthcare team towards a treatment that has been shown to benefit people living with your type of lung cancer. Biomarkers are molecules that can be found on the surface of cells or in the genes. They affect how cancer cells grow, multiply, die, and respond to other compounds in the body. They can also help predict how well your body may respond to a class of treatments called targeted therapy. This type of treatment may reduce the risk of lung cancer from coming back or block it from growing and/or spreading. Some of the most common biomarkers are ALK, BRAF, EGFR, NTRK, PD-L1, and ROS1. It's important to ask your healthcare team about biomarker testing. Biomarker testing is recommended for lung cancer, and results may take 10 to 14 days. You'll discuss this with your doctor before deciding on a treatment. We'll learn more about biomarkers later. Next, let's discuss small cell lung cancer, which is typically grouped into 2 stages, limited and extensive. Limited stage means the cancer is confined to one side of the chest. It may have spread to the lymph nodes on that side, but it hasn't spread to the other side of the chest or any other organs. Extensive stage means the cancer has spread from one lung to the other, to lymph nodes on the other side of the chest, or to other parts of the body. While this was just a brief overview, your doctor will get into the specifics about the type of lung cancer you have. It's essential to ask your healthcare team the questions you have about your cancer. Prepare a prioritized list of questions and bring it to each appointment. The more information you have, the more control you'll feel. You may also want to have someone attend appointments with you as a second set of ears. They can help you take notes and ask additional questions. Now, let's review what we've learned. What to know? There are 2 main types of lung cancer: non-small cell and small cell. Staging informs your treatment options, and biomarker testing results may help guide you to the right treatment options. What to do? Prepare a list of questions for every appointment to ask your healthcare team. Learn more about the stage and type of lung cancer you have. Ask your healthcare team about biomarker testing